Conditions that cognitive behavioral therapy may help. Your child doesn't have to have a diagnosed mental health condition to benefit from CBT, but it can be quite effective in dealing with specific conditions such as attention deficit hyperactivity disorder. Children with ADHD may have a hard time sitting still and may engage in impulsive behaviors. While there are medications to treat this disorder, sometimes they are not the first or only choice of treatment. Even with medications, some children have persistent symptoms. Research shows trusted source that for some teens, adding CBT works better than medication alone. Anxiety and mood disorders. Cognitive behavioral therapy has been shown to be an effective treatment for children and adolescents with anxiety and mood disorders. A 2015 review, Trusted Source, found substantial support for CBT as an effective first-line treatment for children with anxiety disorders. Parents may have a role to play too. A 2010 study, Trusted Source, found that CBT with active parent involvement showed promise as an effective therapy for those ages 3 to 7 with anxiety. The study involved only 37 children, but they showed significant improvement in an average of 8.3 treatment sessions. Anxiety with autism spectrum disorder. Many adolescents with high-functioning autism spectrum disorder have anxiety. In a 2015 study, Trusted Source, a CBT program was designed for preteens with autism spectrum disorders plus clinical anxiety. The program focused on exposure, challenging irrational beliefs, behavioral support provided by caregivers, treatment elements specific to autism spectrum disorder. The small study involved only 33 children from 11 to 15 years old. Parents reported a positive effect of CBT on the severity of anxiety symptoms. Trauma and post-traumatic stress disorder. Cognitive behavioral therapy is a first-line treatment for post-traumatic stress disorder in children and adolescents and has been shown to have short-term and long-term benefits. A 2011 review, Trusted Source, found significant improvement at an 18-month follow-up and a 4-year follow-up. CBT has been found to be effective for acute and chronic PTSD after a range of traumatic experiences, even for young children. CBT may also be helpful in treating adolescent substance use, bipolar disorder, depression, disordered eating, obesity, obsessive-compulsive disorder, self-harm. How effective is cognitive behavioral therapy for kids? CBT is an evidence-based practice shown to be effective for a variety of issues. Meta-analyses show that up to 60% trusted source of youth treated with CBT for anxiety disorders recover with significant decrease in symptoms following treatment. Follow-up studies of children treated in community mental health clinics show that those recovery rates are likely to continue at 4 years post-treatment. Studies show that many adolescents with attention deficit hyperactivity disorder who received CBT had a significant reduction, trusted source, in symptom severity. Among children with post-traumatic stress disorder who receive individual trauma-focused CBT, there can be a great improvement of symptoms of PTSD, depression, and anxiety. In one study, Trusted Source, 92% of participants no longer met criteria for PTSD after CBT. This gain was still seen at the 6-month follow-up.